we're in a crisis of compassion. So for the first time in my career, doctors are turning their shoulders away from patients. They are denying patients care. So this is very, very important.
What does that mean? They're killing them.
They're killing
right?
them. They're killing them.
Dr. Peter McCullough is an internist and cardiologist from Dallas, Texas. He has a long and fairly famed history in medicine, which you can look up if you like, and you should. But more to the point, he has treated COVID a lot.
The scorecard for an academic doctor is the number of citations listed in the National Library of Medicine. I have over 600 citations in the National Library of Medicine. I'm considered the most published person in my field in the world in history. I've chaired and participated on more data safety monitoring boards for drug trials, for device and interventional trials. I've been the overall global principal investigator of studies. I've given presentations before the US FDA, the New York Academy of Sciences, the European Medicines Agency, and I can tell you as a doctor who sees patients with COVID-19 and treats them, I have 40 publications on COVID-19. I am supremely qualified to give my opinions on this crisis. In fact, more qualified than any other individual in the world. There's no one who has that convergence of experience face-to-face with the virus. What's gone on over time is a complete and total program to focus on everything else other than the sick patient. Doctors' eyes became clouded, their hearts became hardened, and they didn't offer the treatment to patients. So initially, there is a complete and total focus on what's called contagion control. Wearing masks, social distancing, hand sanitizers, lockdown, playing defense. Then the next move, some information about how to treat patients in the hospital, a few updates here and there, controversies regarding the drugs. The approaches in the hospital become clear that they're too late, and virtually all the deaths occur in the hospital. The hospital doesn't save the patients. So this concept of playing defense with contagion control and waiting for the hospitalization becomes very apparent, literally within a few months, that this isn't working. We're going to have millions and millions of hospitalizations. We're going to have hundreds of thousands of deaths in the United States with this strategy. Then everything comes into focus. Play defense with contagion control. Hospital, allow the deaths to basically happen because we haven't treated the virus early, and then it becomes clear what the game plan is. Wait for mass vaccination. So there became an understanding on my side of things that somehow my work was caught up in a very high stakes game. And a big part of this game was the suppression of any information on treatment to patients whatsoever. And so once it became known that the plan was mass vaccination, all efforts on treatment were dropped.